Hi, Dr. Stu here to talk to you about science-based practical tips for COVID-19. So today I want to talk to you about something that's really important. What to do if you are sick with COVID-19 and you are home. So let's read the question for today, which is a really important topic. This question comes from Fred, and Fred did not put down what country he's from. So I don't know where he's from, but thanks, Fred, for this question. Dear Dr. Stu, what can be done if you're home and you think you may have COVID-19 symptoms and are not able to make it to the hospital? Is there something that can be done at home? Now, this is a really important question. So there's a couple of facts that I need to tell you about COVID-19. One thing that's really important to remember is that COVID-19, when you start getting significant symptoms, is an infection down in the base of the lungs. So what that means is your lungs will start having a very specific type of infection going on down there, a specific type of pneumonia. One of the things that's really important if you start getting sick and you're not sick enough to go into the hospital, one of the things that's really important is to not spend too much time lying on your back. Now, you're going to want to stay in bed. You're going to feel like you're going to want to stay in bed when you get sick. You're going to have a high fever if you're sick, and it's going to go for a couple of days, up to 10 days. Some people report 10 days of fever. You're going to have a high fever. You're going to feel awful with body aches and just feeling terrible. And you're going to want to stay in bed. But I've got to tell you that that's the worst thing you can do. Get yourself out of bed. Take some Tylenol or take some paracetamol or one of those over-the-counter medications to reduce your fever so you can get up and stand up and breathe deeply. We have a lot more lung capacity in the back of our lungs. And when you lie down flat, you're compressing that lung capacity. So what you want to do is you want to get up. And I know that some of you, when you're having a COVID infection, it's going to hurt to breathe, right? And if that's happening, it's even more important to get up. When you're admitted to the hospital and the people have decreasing oxygen levels, one of the things that we do is we actually lay them on their stomachs. We turn people over in their hospital beds so we can let that more lung mass, the more lung tissue in your back, not be compressed by gravity. So what you need to do, if you're home and you're not sick enough to go to the hospital, but you're feeling crappy, right? What you need to do is get yourself up a couple times a day and walk around a little bit where you are and do some simple breathing exercises. So I want to tell you what I want you to do. It's a combination, and I want you to do this three sets of this, right? So 3 of these is 1 set. Sorry, let's do that again. I want you to do 3 of these per set, and I want you to do at least 1 set 3 to 4 times a day. So what it consists of is 5 deep breaths where you hold your breath at the top of the breath for 5 seconds. And then on the 6th breath, you take a deep breath and then you cough to try and get out some of the phlegm. So let me show you what that looks like. So it's going to be 5 breaths, holding my breath in between. And on the 6th breath, it's a cough. So it's Now that is one set. And you heard my dog walking around. That's my dog, DJ. So you noticed I took 5 deep breaths, holding my breath for about 5 seconds in between. And then the 6th one, I took a deep breath and coughed. I want you to do that 3 times, 3 to 4 times a day. All right? Now, I got a little bit dizzy, lightheaded doing that. And you may do that. So take a pause in between sets, right? Do it 3 times, rest a little bit, do it 3 more times, rest, do it 3 more times, and then you're done for that moment. It's a calm thing, but it will help expand your lungs and actually get the areas that are collapsing with pneumonia to expand. But I want you to make sure you get out of bed a couple times a day to do your breathing exercises and to keep your lungs filled with air. Your lungs are going to be injured or can be injured by this virus. It's one of the things that it does if you end up with lower respiratory infection. Right? Some people just have the sore throat part or just lose the sense of smell or taste. Right? But some people actually end up with some chest problems. Now, the one thing I want to remind you is if you're having significantly difficult time breathing, you need to go to the hospital. What I'm talking about is somebody who is not a high-risk person, who is feeling okay, but just coughing a lot and have a high fever, but not having any respiratory distress. But you're feeling run down or achy or really awful from the fever, but you're not having significant breathing problems. I want you to stay that way by gently exercising your lungs. If you have any questions about this or anything else about COVID-19, please send them to me at drstu.org. Thanks so much. Stay safe, stay home, and we'll see you tomorrow.